Okay, so this is the continuation of our discussion sa skull. So next will be the mandible. So first examination for mandible is PA projection. Again, the same position na siya ng ating skull PA. So central ray is perpendicular to the IR. So the same thing, head is rested on chin and nose. And this is for the demonstration of the condylar processes ng ating mandible. So, sa central ray naman, so perpendicular na siya sa IR again, para clear tayo. So, central ray is perpendicular to the IR. If we want to demonstrate the condylar processes of the mandible, so the central ray is perpendicular sa glabella. To demonstrate the rami or the ramus, if singular, so the central ray is centered to the tip of the nose. For general survey, central ray is perpendicular sa lips, and this is done to perform, in general, the mandibular rami, the lateral portion of the body of the mandible. Usually, this is performed to demonstrate the medial or lateral displacements of fragments in fracture of the rami. For the PAH projection, again, the same na siya ng PAH projection na discuss na natin before. So, may angulation na siya. Central ray is 20 to 25 degrees cephalad. As you can see, there's a picture to exit the acanthion. So this is performed to demonstrate the proximal rami and the lateral aspects of the body of mandible. So well visualized, an elongated view of the head and the mandibular condyles are also seen. Next, for the atriolateral, so patient in erect, supine, or prone position, depende kung ano yung mas prefer, hindi naman mas preferred, ano yung kaya ng patient. So head must be in true lateral position to demonstrate the ramus. For general survey, the head is rotated 10 to 15 degrees towards the image receptor. To demonstrate the body of the mandible, the head is rotated 30 degrees towards the IR. And for demonstration of symphysis menti, so the rotation is 45 degrees towards the IR. So yung rotation ng head, depende kung ano yung ating area of interest. And kahit na ano yung rotation ng head niya, the central ray is 20 to 25 degrees cephalad to exit the acanthion. So the same na siya ng PA-axial. Kaya lang sa axiolateral, pwedeng naka-erect, pwedeng naka-supine, or pwedeng naka-prone ang patient. Basta naka-lateral siya. Then, for the AP-axial projection Towns method, the same na din siya ng position ng Towns na na-discuss natin sa previous video. So, central ray, so 35 degrees caudad to OML. Pero if IOML naman, 43 degrees caudad to 3 inches above the nasyon. So it demonstrates the axial image of the condyloid process of the mandible and mandibular foci of the temporal bone. So sa SMV, the same pa rin, the same position. So central ray is perpendicular to IOML between the angles of mandible or 1.5 to 2 inches inferior to the mandibular symphysis. This is performed to demonstrate the horseshoe-shaped mandible bone or mandibular bone and as well as the entire mandible. So as you can see, there's a picture sa right, so para siyang horseshoe. Next is the panoramics or the panoramic tomography. As you can see, there's a picture sa right. So adjust the chin rest until IOML is parallel with the floor. As you can see sa picture sa baba. So special unit siya, X-ray unit. Occlusal plane will decline by 10 degrees from posterior to anterior. So yung ginagamit na radio na film is different from the regular. So para siyang gamit ng mga dentist na film. Align MSP with vertical center line of the chin, rest. Central ray is directed slightly cephalic. So this is not commonly performed naman sa ngayon sa ating department. So this is done to demonstrate single frontal projection of the teeth, the mandible, the nasal fossa, the zygomatic arches, and the maxilla. So yung kanyang image ay itong sa right. Then, next for the mastoid and temporal bone, baba natin. So axiolateral position or law method, or also referred to as the double tube angulation method. The patient can either be in semi-prone or upright with head turned to lateral position, as you can see sa picture dyan sa right. IUML is parallel to long axis of the IR, IPL, or the interpupillary line is perpendicular sa IR. The auricles of the ears, so iti-tape siya forward para hindi siya mag-superimpose sa mastoid. So central ray for law method, double angulation is 15 degrees caudad and 15 degrees anteriorly to 2 inches posterior, 2 inches superior to the uppermost EAM. So bali yung kuha natin sa ating central ray, 2 inches posterior sa likod ng EAM, and then 2 inches pataas. So posterior muna, so pwede rin superior, then posterior. Basta yung kanyang location. And then, i-angulate natin ang tube 15 degrees pababa, pero pupunta sa harap. 15 degrees caudad, 15 degrees anterior. Kaya double angulation ang tawag. Dito naman sa ating modified law, single tube lang. So 15 degrees lang. 15 degrees angle in relation to the table. So central ray is 15 degrees caudad. Wala na siyang anterior, caudad na lang. So 2 inches posterior and 2 inches superior to the uppermost EAM. This is performed to demonstrate a lateral perspective of the mastoid air cells closest to the film. Again, when we say air cells, this is the other term for sinuses. So, pinagkaiba ng single tube and double tube angulation ng law method is that, again, sa double angulation, so 15 degrees caudad, 15 degrees anterior. Sa single tube naman, sa modified law, 15 degrees caudad lang. That is for the mastoid and temporal bone. Next is the standverse. So, patient must be either in prone or upright position, as you can see sa picture. Head is resting on forehead, nose, and zygoma. IUML is perpendicular sa IR, and the MST forms an angle of 45 degrees in relation to the table. So central ray is 12 degrees cephalad to 1 inch anterior to EAM closest to film. So medyo naka-rest ang head sa forehead, nose, and zygoma. So this is performed to demonstrate the downside petrous bone profile or the petrous ridge, petrous bone near the table, as well as the mastoid process. Another one, profile projection then. So, ang standverse is posterior. Yung arceline is anterior. So, arceline, this is performed for children and adults na hindi kayang mag-prone position. So, kumbaga yung ating arceline is the reverse of standverse. So, patient supine, rotate face away from side, being examined. So, IUML is perpendicular to the IR. The MSP forms an angle of 45 degrees in relation to table, and the central ray can add 12 degrees dito sa standverse, sa arceline 10 degrees. So, it demonstrates the upside naman, petrous bone and mastoid process. So, standverse, downside, petrous, arceline is upside. Next is axiolateral position, Henschen, Schuler, and Fleischung method. Ito lumabas sa board exam. So, patient is in prone position. So, nakalateral yung head MSP and IOML parallel sa IR, IPL is perpendicular. So, tatlo ang central ray niya sa ipsilateral, depende kung anong method. Kung ano ang target, ano ang ating area of interest. Sa Henshen, 15 degrees caudad to demonstrate the tumors sa acoustic nerve. Sa Schuler, 25 degrees caudad para sa pneumatic structure of the mastoid process. And sa Lysium, 35 degrees caudad to the EAM closest sa IR. The Lysium projection is also referred to as the Armstrong 2 method. Yan lang naman yung mga importante sa board exam central ray, structures demonstrated, patient position. Next is Mayer method. So, nakasupine din ang patient as you can see there sa picture. Rotate the head towards the side of interest. The MSP, 45 degrees sa table. So, the chin is depressed or ibaba yung chin as you can see there. So, this is to place the mastoid process in close contact sa IR. The IOML is parallel with transverse axis of the film. So, central ray sa Mayer is 45 degrees caudad patungo sa AEM near the table. This is performed on Mayer to demonstrate an end-on view of the downside petrous portion, also to demonstrate mastoid air cells located in the center of the IR, and also the petrous portion located inferior to the mastoid portion. So, sa Mayer yan. Next, sa Owen modification. So, nakasupine ng patient. The head is rotated towards the side of interest. The MSP, since rotated ang head, the MSP forms an angle of 30 to 40 degrees. So, this is performed to compensate for anatomical variations or for better delineation and less distortion of specific area. So, ginagawa yung Owen modification para sa mga patients na hindi kaya yung mga nabanggit natin before, hindi kaya yung Meyers, yung Henshen, Schuler, Lysium, yung Arcelin, Stenberg. So, ginagawa yung, kaya modification siya. So, next at TMJ, or the temporomandibular joint. So, we have here the Schuler. So, the same pa rin kanina. So, Schuler, 25 to 30 degrees caudad, central ray, to 1/2 inch anterior and 2 inches superior to the EAM. This is to demonstrate the condyles near the IR. So, Schuler yan for TMJ. Next is the modified law method or the axial-oblique projection. So, pareho lang din kanina ng ating modified law, patient semi-prone, MSP 15 degrees to IR, IPL and IOML perpendicular sa IR. So, the patient open and closed mouth. Bali, dalawang exposure siya. Isa yung open, isa yung closed mouth. Kaya modified siya. Central ray, pareho lang for open and closed, 15 degrees caudad. Demonstrate relative position of condyles near the IR with respect to the temporomandibular fossa. Another one, we have the modified sounds. So, patient in supine or erect position, MSP perpendicular to IR. If hindi kaya ng OML na mag-perpendicular, so IOML ang perpendicular, so add 7 degrees. Katulad ng discuss natin sa previous video. Central ray is 35 degrees caudad if OML ang perpendicular. Pero if the IOML is perpendicular to the IR, so 42 degrees caudad. Kasi di ba 7 degrees yung difference. So it will enter 3 inches above the nasion. So it demonstrates the axial image of the condyloid process of the mandible and mandibular fossae of the temporal bone. Next, the infero-superior transfacial position. So patients semi-prone din, IPL, 10 to 15 degrees. MSP, 15 degrees, open close then unless contraindicated or hindi pwede sa patient. Central ray is 30 degrees caudad to, 30 degrees cephalad to gonion. Gonion is your angle of mandible that is farthest from the IR. So it will exit through the TMJ closest to the film. So this is performed to demonstrate oblique lateral image of the TMJ, the open and closed mouth position. Next is Albert-Schoenberg. So semi-prone then, head and two lateral. MSP is parallel. IPL is perpendicular. So open closed mouth then. So mga modifications sila depende kung ano yung area of interest. Best demonstrated the structure na kailangan ng doctor and sa condition din ng patient. So nag-iiba lang sila sa central ray. So central ray for Albert-Schoenberg is 20 degrees cephalad to TMJ closest to IR to demonstrate the lateral image of the TMJ. Next is Sanelli. So Sanelli, patient is in lateral position. MSP is 30 degrees. So as you can see, there's a picture. The chin is rotated. The affected side. Open and closed mouth then. Central ray naman, wala siyang angulation, perpendicular lang to 1/2 inch anterior to EAM. So lateral images are demonstrated to the open and closed mouth position. So this is using, so bali ang pinagkaiba ng Sanelli sa mga nabanggit natin na projections is that ang Sanelli walang angulation ang tube. Instead, ang patient ang nag-adjust. So as you can see, yung patient ang nag-tilt. So for the orbit, contains the vital organ of sight and associated nerves and blood supply. So ito yung sa cranial bone. So the circular base of orbit, so we have there the frontal bone, forms the roof of the orbit. Ang zygoma naman, lateral wall of the orbit. Ang maxilla naman is the floor of the orbit. So lacrimal bone, sa medial wall, sphenoid and ethmoid, posterior part. The palatine bones is the innermost portion of the floor of the orbit. So bali, these are the different cranial bones that make up the orbital ring. So there are three openings. We have the optic foramen, superior orbital fissure, and the inferior orbital fissure. We also have the term sphenoid strut. This is the small root of bone separating the superior orbital fissure and the optic foramen. So there are two most common orbital fractures that are seen sa radiographic examinations. We have the blowout fracture and the tripod fracture. Blowout fracture, so this is caused from a direct blow to the orbit kapag sinuntok ka sa mata, kapag tinamaan ka ng bola sa mata, or kapag hinampas ka sa mata mismo. So blowout fracture ang tawag. So tripod fracture naman, this is a unique fracture to the facial bone and involves the zygomatic bone and its three attachments like the maxilla, the temporal, and the frontal bone. Kaya tinawag siyang tripod fracture. So one of the most common examinations performed in orbital examination is the Reese method, which is also referred to as the 3-point landing. So Reese method, 3-point landing, because tinawag siya na 3-point landing because there are three parts of the face that comes in contact with the IR, the zygoma, the nose, and the chin. Or we call that the cheek, chin, nose. So naka-prone ang patient syempre kasi paano naman mag-come in contact yung kanyang cheek, chin, and nose kapag nakasupine siya, di ba? So center the IR to the orbit farthest from the film. The acanthomeatal line perpendicular sa film, MSP 53 degrees. So utilize, gamitin natin ang small focal spot and close collimation para ma-sharper yung image natin. So walang angulation. So this is, ang central ray niya is perpendicular lang to the affected orbit which is closest to the film. So the Reese method is used to demonstrate the optic foramen at the lower outer quadrant and as well as to demonstrate the entire orbital shadow. So if the patient cannot assume the prone position, meron tayong tinatawag na reverse gaze. So syempre nakasupay naman sa patient para sa mga patient na hindi kayang prone. So AML perpendicular sa plane of the film. MSP still is 53. So ginagamit lang ito sa mga patient. Nasabi ko na hindi kaya mag-prone position. So since nakasupine yung patient, malayo yung orbit, so there will be a magnification due to increased OID. Of course, there is also an increased radiation dose kasi nakaharap yung patient sa tube. So central ray, no angulation, perpendicular siya sa uppermost orbit. So the same na naman ang kanyang demonstrated areas of the foramen at the lower outer quadrant. Another one is Alexander method, orbitoparietal oblique position din siya. So para siyang reverse this. Pinagkaiba lang is the central ray. So, patient supine, so yung occiput o yung inion, 15 degrees cranially inclined sponge, katulad ng nakita natin dyan sa picture sa right. So, yan yung difference niya sa wrist. Rotate the head with the side of interest farthest from the film. AML, perpendicular din. The MSP, instead of 53, 40 degrees lang siya. Yun yung pinagkaiba ng Alexander sa waters and, sa wrist and sa reverse wrist. So MSP is 40 degrees. So demonstrate perpendicular, central ray perpendicular directed to inferior and lateral margin of the outermost orbit. So ang ating wrist naman and reverse wrist, perpendicular directed to the uppermost. So itong ating Alexander, directed to inferior and lateral margin of the uppermost orbit. So the same na ang demonstrated areas, optic foramen and optic foramen at the lower outer quadrant. Another one is the parieto-orbital oblique position or the U method. So syempre naka-prone kasi parieto-orbital, it will enter the parietal bone, it will exit the orbital structure. So center lang sa affected orbit, rest the superciliary ridge and the side of the nose of the table. IUML is perpendicular, the MSP is 20 degrees. Central ray is 7 degrees lang, caudad to exit the affected orbit. Ito siya. It demonstrates the unobstructed and undistorted image of the sphenoid strut which is projected at the center of the orbital shadow. And this is also good for visualizing any deformity or lesion na makikita sa strut bone if there is a lesion. Then we also have the PAH shell projection. So naka-prone. So rest patient, forehead and nose, OML perpendicular, and SP is also perpendicular. So para siyang Caldwell. So central ray is 20 to 25 degrees caudal. So this is to demonstrate the superior margin of petrous portions of temporal bones as well as the superior orbital fissures. We also have here the Bertel method. So naka-prone din siya katulad ng picture dyan, forehead and nose resting on the table. OML and MSP is perpendicular to the midline of the table. Central ray, parang pareho rin siya, 20 to 25 degrees, kaya lang cephalad. So yung PAH shell natin is 20 to 25 degrees caudad. Sa Bertel naman, 20 to 25 degrees cephalad to exit the nasyon. Ito to exit at the level of the inferior margin of the orbit. So this is to demonstrate the orbital floors and the infraorbital fissures. Then we also have specialized examinations for localization of foreign bodies sa orbit. The eyeball is a nearly spherical thin-walled capsule filled with fluid and gelatin. So kailangan high film quality, use fine detail, OID should be minimized. So dapat it should be as close to the IR as possible. Use small focal spot, minimize film fog, and use tight collimations or foam. So ang ginagamit to localize, to locate foreign bodies sa orbit. First, we have the Vought bone tree. So this is for Vought bone tree for vertical movement images. So ang tatandaan lang natin dito, minsan kasi yung lumalabas na sa board exam, kung ano yung, which of the following are performed to localize foreign bodies sa orbit. So ito lang, Vought bone tree, parallax motion method, sweep method. So usually hindi naman tayo mag-tech ang nagpa-perform ito, kundi yung mga ophthalmologists or yung mga doktor sa mata. So ayan lang, Vought bone tree, parallax motion method, and sweep method. And also another one is the Pfeiffer-Comberg method. So this is rarely used today. So ayan lang. Gumagamit ng contact lens sa Pfeiffer-Comberg. The sweep method, meron siyang special device which is called the sweep localizing device. So yung mga special machine, special units na yun lang. So that's it for our skull positioning. So yan na yung last topic natin.